Alright, I'm going to start by comparing my doctor's orders to my MAR. I'm going to make sure that it's the right patient, and it is. I'm going to make sure that it's due at the right time, and it's due at 3 o'clock. And that's what time it is. I have an order for Solumedrol, 10 milligrams, IV push every 6 hours. So the medication is Solumedrol, 10 milligrams is the amount, IV push is the route, and every 6 hours is going to be our time. We've already checked for patients, so now I'm going to check for allergies, which there are none. So now I am going to, once again, just one more time, check my MAR for the second check, making sure that everything is the same. And it is. So now I'm going to check for the safe dosage. And since we have Solumedrol 10 milligrams, the usual dose is 10 to 40 milligrams, so that is a safe dose. For dilution, it's available in active vials, but since we have, after I've done the math, 0.3 milliliters that we have to give, I have to further dilute. So I'm going to add 2.7 milliliters of normal saline, and I know that normal saline is compatible because my book says so. And checking orders and patients' MAR, I see that they have normal saline hanging in the room. So I know that's going to be compatible when I push through. But I'll check one more time once I go in. For rate of administration, it's a single dose of 10 milligrams over several minutes. So we're going to be given every 3 minutes. And after I further dilute with a 2.7 normal saline, it's going to equal up to exactly 3 milliliters, so 1 milliliter per minute. For my precautions, I need to monitor my serum electrolyte levels because it may cause sodium retention and potassium calcium excretion. I also need to monitor the blood pressure for hypertension and for signs and symptoms of infection. When I go into the patient's room, I need to report to him that he needs to tell me if he experiences any edema, tarry stools, or weight gain. So now I'm going to prepare my equipment. I'm going to wash my hands. I'm going to gather my medication, my diluent. So I have a Solumedrol. I'm comparing to the MAR, making sure I have the right medication. So Solumedrol, normal saline. I have a label. I'm going to get a 3 milliliter syringe. I'm going to get 2 alcohol swabs. Okay, I'm going to scrub each top for 15 seconds and allow them to air dry. Okay, I'm going to administer first into my diluent, and that's going to be 2.7 milliliters of air. I'm going to pull back to 0.3. Okay, that's 0.3 of my Solumedrol. We're going to pull back to 3. Okay, I have 3 milliliters in the syringe. Now I'm going to recap and fill out my label. Putting down 10 milligrams Solu-Medrol and put my initials on it. Okay, now I've got everything ready. I'm gonna put my medications back. Got my syringe labeled. Got my alcohol swab. Now I'm gonna prepare to go into the patient's room. Okay, got my medication and my swab. I'm gonna knock on the door, introduce myself. Hello, my name is Kennedy. I'm gonna be your RN today. I'm going to be delivered an IV push of Solu-Medrol. That's an anti-inflammatory. Your doctor has ordered 10 milligrams, and I'm going to go ahead and check with my MAR. Ask my patient to tell me his name and date of birth, which is correct. I'm going to ask the patient to verbally tell me if he has any allergies, which he does not. Checking my solution hanging up on the wall, checking expiration and clarity. It's normal saline, and as we know, that is compatible. And one last check with my Solu-Medrol and my MAR. I'm going to assess the site, make sure there's no redness or warmth or irritation. Now I'm going to lower my bag to check patency. And I saw blood return, so I know it's patent. Now before I begin, I'm going to wash my hands. I'm going to scrub the hub closest to the patient. Seconds and allow to air dry. Without touching the hub, keeping it sterile. I'm going to apply, kink the tubing, and we're going to administer 1 milliliter for every minute. So starting my time now, I've got it kinked. I'm administering 1 milliliter. I'm gonna let go. While I'm administering, I'm gonna be watching my patient for his response. I'm going to tell my patient to report any tarry stools, any weight gain or edema after the administration. Okay, full minute has passed. Kinking the tubing, administering 1 milliliter, unkinking, Okay, kinking one more time and administering the last milliliter. Okay, I'm observing the site. I'm going to take the syringe out, dispose of everything. I'm going to put my needle in the sharps, and I'm going to lower my patient's bed, make sure side rails are up, wheels are locked, and I'm going to again remind him to let me know if he experiences tarry stools, weight gain, or edema. And I'm going to document everything I've done, and that's the end of it.